Hi, class. All right. I am happy to be teaching you all again. I look forward to seeing you just in very short couple days. Um, all right. Welcome to Trauma-Informed Counseling. Before I go over the syllabus, there's something that I want to start off by saying. There is a saying in our field that when we become a therapist, it's because we could call ourselves the wounded healer, meaning that we have either experienced pain and trauma and hardships in our life, which is kind of what led us into this field in the helping profession, because we want to help others. That being said, I am going to teach you and train you on how to treat trauma. You will, not matter of if, but when you have a client with severe trauma, going to teach you how to identify trauma, how to diagnose trauma, and the effective ways to treat trauma as a clinician. That being said, because we are human beings and we um, hear things and conceptualize things through our own lens, through our own experiences, this class can be really hard. We're going to be talking about really hard things in this class. Just a warning, do not allow children around the live lectures. If you're going to be listening to my videos, even the live lectures, we're going to talk about really traumatic stuff. So do not allow, unless you want your kids to hear traumatic stories, but just a warning. Because this class is going to cover heavy topics, there is a good chance that some of you, if not a good portion, will get triggered and will have a hard time metabolizing this material, especially if you have not done your own work yet. That being said, I want to hold space for you and I want to support you while helping you learn skills to treat trauma. In this field, you will get triggered talking with a client. You will experience countertransference. The goal is not to avoid countertransference. The goal is to learn how to work through it, to identify it, and to manage it. That being said, please come to me. I want to be a support. I want to be a resource. I want to help you. If you find yourself getting overwhelmed by the material covered in this class, please do not hesitate to reach out to me. I will guide you and give you the steps and support you along this journey. It is an 8-week class, as you know. It's going to be intense. We're going to cover a lot, but just prepare yourself if you find yourself getting triggered and flooded with some of the material you're reading and some of the lectures and the videos that you will be watching. The other thing that's super important is to practice self-care. If you find yourself getting overwhelmed or getting flooded and triggered, please do not minimize it. Don't shove it down. Don't pretend it's not there. Really practice some of the self-care strategies that we're actually going to cover in this class. That being said, let's dive into the course requirements. I do think this class is easier in the fact that with the assignment wise, it's easier, but content is going to be harder. Okay. First, we're going to have a group assignment. So just like the role plays, you're not going to be doing a role play. You're going to be creating a treatment plan and presentation in groups, where as a team, you are going to create a presentation and present the case, present the diagnostic criteria if this case has PTSD, has acute stress disorder, has adjustment disorder. Let me back up for a second. We're going to cover the main diagnosis under the trauma umbrella. This is super important because you're not going to be diagnosing depression. You're not going to be diagnosing anxiety. you're going to be diagnosing trauma. So some of the case studies might look like depression or anxiety or another DSM diagnosis. We're only going to be diagnosing trauma in this class. And so you're going to get a case study, and then I'm going to teach you how to diagnose trauma and the different types of diagnosis under the trauma umbrella. So in your presentation, you're going to be given a case study, for example, a house fire, shooting, rape, and you're going to be using a trauma-informed treatment plan and the modality of your choice that we're going to cover in this class. Just like the previous class, your treatment plan are going to include treatment goals and treatment interventions, as well as the diagnostic criteria. Okay, it's going to be about a 10 to 15 minute recorded video presentation and then 10 to 15 slides. All right, after you upload your video, the next week, you're going to look at 2 different groups video, and you're going to do your own peer evaluation. Each individual student is going to do their own peer evaluation. You're not going to evaluate each other's presentation as a group. So each individual is going to pick 2 other groups, and you're going to do your own evaluation, and you're going to upload your own evaluation of 2 other groups. The other assignment is a case study. I'm going to give you a case study, and then you're going to diagnose the client in the case study using DSM criteria, which we're going to cover in this class. In addition, you're going to add a differential diagnosis if it is there. Based on your assessment diagnosis, you're going to do 3 treatment objectives to treat the trauma and 3 interventions for each goal. And then lastly, the spiritual integration. And then the next assignment is going to be a self-care plan. One of my favorite topics in this class is when I talk about compassion, fatigue, and vicarious trauma. So you're going to, after you listen to the lecture, going to write a paper on your understanding of compassion, fatigue, and vicarious trauma. And then you're going to create a plan of how you're going to prepare and respond to when, not if, you experience vicarious trauma. And then if you just follow the outline in Moodle, the rubrics, you should be fine. Lastly, we have our discussion board and then your class participation. All right, I look forward to seeing you guys very shortly. As always, if you have any questions, feel free to reach out.